Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is July 19, 2025. This video is on a New England Journal of Medicine article titled Non-Surgical Management of Chronic Venous Insufficiency. It was published in the New England Journal of Medicine in December last year. Doing this podcast because there was a press release from the White House that the president had mild swelling of his legs and he's been diagnosed with chronic venous insufficiency. Here are these two articles, one in the Wall Street Journal and one in the New York Times. What is chronic venous insufficiency? Chronic venous insufficiency is caused by elevated venous pressure leading to symptoms like leg swelling, varicose veins, skin changes, and ulcers. What causes chronic venous insufficiency? It can be structural, venous reflux or venous obstruction, functional, high body mass index, weak calf pump, or both. What are the major factors? Age, female gender, increased body mass index, pregnancy, deep vein thrombosis, prolonged standing, height, and genetic variants. That 30 SNPs have been described. What is venous hypertension and how does it contribute? High venous pressure causes endothelial dysfunction, inflammation, and redox imbalance, leading to tissue damage. What role does the calf muscle pump dysfunction play? Impaired calf pump reduces venous return, causing stasis and symptoms. How is chronic venous insufficiency diagnosed? Primarily clinical with duplex ultrasound to assess reflux. Greater than 0.5 seconds is superficial and greater than 1 second is deep. What medications can mimic chronic venous insufficiency? Calcium channel blockers, carbapenemoids, antidepressants, estrogens, glucocorticoids, and NSAIDs. What are the main non-surgical therapies? The four pillars are reduced central venous pressure, compression, leg elevation, calf and foot exercise. Recommended compression levels: greater than 30 millimeters of mercury for ulcers, 20 to 30 millimeters for mercury, often better tolerated. When to avoid diuretics? Avoid unless fluid overload. Otherwise may cause hypovolemia and worsen symptoms. Which exercises help? Calf raises, foot flexions, toe curls, and gait training. When are interventions indicated? If structural disease correlates with symptoms or ulceration. Examples of effective procedures: laser or radiofrequency ablation, foam sclerotherapy, and venous stents. What about the role of venoactive drugs? Weak evidence, class 2B, 2A, may help with swelling, not ulcers. What do guidelines recommend? Procedures for axial reflux, class 1B, compression for ulcers, class 1A, early intervention per EVRA trial. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.